knock, hand hygiene, put gloves on. Hey, my name is Lexi. I'm gonna be your student nurse for today. Could I get your name and date of birth?
Kelsey Ellis, 4/24/03.
Okay, perfect. And do you have any allergies?
No.
Okay. So I'm gonna be performing head to toe assessment. Could you tell me where we are right now?
Skills Lab.
Okay, and what was the last major holiday we had?
4th of July.
Okay, so patient speech is clear, effect is appropriate, movement is fluid, effect is appropriate. Okay, so now I'm gonna start by looking in her eyes and looking at her pupil size. So make a bright light in your eyes. Okay, so pupils are round, equal, reactive to light. Pupils were about a 3 millimeters and brisk. So I'm just gonna have you look at my finger and it's gonna come towards you. Okay, eyes accommodated to light, or to my finger as well. Patient's face is symmetrical. Do you wear any hearing aids or hard of hearing in your left or right ear?
No.
Okay. Do you wear any contacts or glasses?
No.
Okay, so hearing and vision is appropriate and intact. Now I'm gonna look at her nose. Okay, nose is patent, and now I'm gonna have you open your mouth and look in there. Okay, no missing teeth. Do you wear any dentures or anything?
No.
Okay. Skin is also visibly intact, no drains or wounds. Okay, and now I'm going to move down to the cardiac section. So I'm going to start by feeling her radial pulses. Okay, those pulses are 2+. I'm also going to feel her pedal pulses, and I would do this on the skin as well. Okay, those were 2+. And now I'm going to get her pulse ox and her pulse. And I'm also going to take her blood pressure. Okay, patient's pulse ox is 98 and her pulse is 65 beats per minute. I felt her pulse around 100, so I'm gonna add 20 to that and go up to 120. Okay, her blood pressure was about 110/70. And now I'm going to listen to her heart sounds, and I would do this on the skin. So I'm going to start by listening to the aortic valve and the pulmonic valve and Erb's point. The tricuspid valve and mitral valve. Okay, S1 and S2 noted, and I did not hear any murmurs or extra heart sounds. Now I'm going to do her capillary refill on her fingers. Okay, capillary refill was under 3 seconds for her hands, and I'm going to do on her toes as well, and I would do this on the skin. Okay, capillary refill was under 3 seconds. And while we're here, I'm going to go ahead and take her temperature. Just going to put this under your tongue. temperature is 98.4. Now I'm going to move on to respiratory. So I'm going to look at her lungs and inspect. Her lungs are moving symmetrically, up and down. I don't see any accessory muscle movement. And now I'm just going to count her respirations for 30 seconds and then multiply that by 2. Okay, so her respiratory rate is about 16 breaths per minute. So now I'm going to listen to her anterior lungs, and again, this would be on the skin. So I'm gonna have you take a deep breath in every time my stethoscope touches you, okay? Now I'm gonna go a little bit under on the side. And the other side. Now if you can sit it for me, I'm gonna do the posterior side of her lungs. And if you just take a deep breath for me every time my stethoscope touches your back. Okay, you can lay back down. So breath sounds were clear and equal. I did not hear any wheezing or any stridors or anything like that. So now I'm going to move on to the abdomen. First I'm going to start by inspecting. The abdomen looks to be flat, no distension or any free fluid moving around. So then I'm going to auscultate in all 4 quadrants and listen for bowel sounds. And again, this would be on the skin. I'm going to go in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower. Okay. Bowel sounds were present in all 4 quadrants. Now I'm going to do a light palpation to feel for any tenderness or distension, so just let me know if you feel any pain. No. Okay. And when was your last bowel movement?
This morning.
Okay, and do you have any symptoms of nausea, vomiting, diarrhea?
No.
Okay. And for urinating, do you urinate by yourself or use a assisted device for that?
By myself.
By yourself, okay. And did you notice anything abnormal the last time you urinated?
No.
Okay. What was the color like?
Light yellow.
Light yellow, and was it cloudy, clear?
Clear.
Perfect, so urination is normal. So now I'm gonna move on to her skin. I'm gonna feel for any edema. Okay, don't feel any edema, and her skin is dry, warm, intact. And I would be doing this on the skin, under the gown. Don't feel any edema, skin is dry, don't see any IV lines, no scratches, wounds, anything like that. So now I'm gonna move on to your strength. So I'm gonna have you squeeze my arms, or my hands, perfect. And I'm gonna have you push down with your feet and pull up. Okay, so strength was equal and a 5+ for her arms and her legs. So now I'm gonna have you get up and I'm gonna inspect your gait. Okay, now you come back. Okay, gait was normal. Do you use any assistive devices, like a walker, cane, have a boot or anything like that?
No.
Okay, so patient's gait was normal. Strength again was a 5+ for her legs and arms. And again, there's no IVs or dressings or anything like that, no extra tubes or drainage. And that concludes the head to toe assessment.